The cost of HIV drugs has dropped enormously. Not long ago, treatment was something which was only available to the wealthy. But now, more than 4 million people around the world are being treated with antiretrovirals, or ARVs, an effective form of treatment that allows HIV patients to live a long and healthy life.
In terms of impact, we've seen people's lives being improved, people's quality of life being maintained, and less of people dying of HIV-related complications.
However, the HIV crisis is still far from over. In 2009, 2 million people died of HIV-related diseases. Close to 60% of those in need of treatment are still not getting it.
A lot has been done, but a lot more needs to be done. And I don't think we can always say it's enough. We still are facing new challenges that are coming up.
MSF has started to observe a very worrying recent trend, where some international donors are presently capping or even reducing their involvement in HIV/AIDS.
As we speak, people are dying of AIDS. Millions are dying. There is still 6 million in Africa waiting to start treatment. It means they will deteriorate, they will get ill, and they will die. And what's worrying, in spite of the fact that there is so much more to be done, donors seem to lose interest in the fight against AIDS.
The President's Emergency Plan for AIDS Relief in the US, known as PEPFAR, is a major global donor for HIV/AIDS. In 2009, PEPFAR reduced for the first time its budget for purchasing antiretroviral drugs. This has already translated into a reduction in the number of new people who can start treatment. Dr. Margie Hardman runs a PEPFAR-funded clinic for HIV patients in the Mpumalanga province in South Africa. In November 2009, she was told to stop enrolling new patients.
We were told at that stage that we couldn't put more patients on ARVs because of the funding was insufficient for that. So basically we had to turn those patients away. Those that couldn't start is worrying because quite often they were really very sick and we don't know how many of them died or what happened to them, unfortunately.
What we see now happening after 6 years of proper management is that there comes a donor fatigue from all sides, and they see that the successes of the treatment is going to be a liability. What I mean with that is, once you put an HIV/AIDS patient on treatment, you have made a commitment for life.
In 2010, the Global Fund, the biggest donor in the fight against HIV/AIDS, faces a major funding shortfall. Other donors, such as UNITAID and the World Bank, have announced reductions over the coming years in the funding for HIV. Less funding from international donors means more and more patients will go untreated, because many low-income countries continue to depend on foreign funding. The lack of substantial commitment from donors is straining already fragile health systems.
MSF teams are increasingly confronted with requests for help. The Ministry of Health, local or international NGOs are asking us to step in with emergency supplies to avoid stockouts. In Malawi, the Minister of Health was facing a threat of stockout. MSF had to bring in emergency supplies for some 3 months or so.
If not enough money is put into the funding pot, more people will die because they could not access treatment. Public health structures in low-income countries could once again become overwhelmed with dying patients.
If they decrease the funding for the HIV, then it will mean more people die and we have more orphans and some will lose hope and go to the home areas where they'll die and it will be the end.